As the healthcare leader of the Tri-Parish community, Terrebonne General Medical Center is a nationally recognized facility providing state-of-the-art technology and advanced services. Terrebonne General compassionately provides the most services responding to the greatest needs for our community. All right, there you see our guest tonight, Kim Murphy, who's a charge nurse at Terrebonne General Medical Center. You can wave. Kim, there you go, there you go. And Nancy Izaguirre, who's the nurse director of Terrebonne General Medical Center. And we're going to talk about the emergency department at Terrebonne. All right, Nancy, first of all, what types of emergency treatment, to start off, does TGMC offer?
In the ER at Terrebonne, we treat any type of emergency. We use a nationally standardized triage system called the Emergency Severity Index, or ESI. Triage is a method of prioritizing each patient that comes through the emergency department. The triage nurse interviews the patient and assesses his or her need to see the physician. An acuity level is assigned to the patient according to the ESI. Level 1 would be the most acute patient, and level 5 would be a minor patient. Then the patients are seen in the order of acuity as the bed space allows in the back. We also have a fast track area that we treat the less acute patients in. Our fast track is staffed by mid-level providers. Our hours are 7 a.m. till 2 a.m. on our busiest days of the week, which would be Saturday, Sunday, and Monday. We're staffed 11 a to 11 p on Tuesday through Friday. And then beginning July 1st, we're going to have new hours. We'll be staffed 9 a.m. to 1 a.m. on every day of the week.
Right, so you said Saturday, Sunday, and Monday.
That's our busiest days.
I thought Friday would have been able to see. I learned something new
not.
all the time. How many patients receive emergency care?
Well, the last few years, our volume's been over 40,000. This year, we expect to have about 45,000 visits.
Wow, that's quite a bit for sure. The what is considered a common emergency? I mean, when do people go in? When should they go in? What's common?
Well, an emergency is a medical problem that can result in death or permanent injury if it's not treated quickly. Some of the ones that we see are severe bleeding problems, chest pain, respiratory or breathing problems, ingestion of poisons, inability to move or speak, decreased level of consciousness, broken bones, severe persistent vomiting or diarrhea, head injury, or gaping wounds.
Okay, and Kim will turn our attention to you. Urgent care situations, what would qualify for that?
Urgent care situations we call fast track. They're the same. If you were seen at an urgent care, you would see the same types of patients in our fast track. We call them non-emergent emergencies. Those are situations where the patient needs to be seen in about 12 to 36 hours. Some examples are minor respiratory complaints, minor head injuries, such as those without symptoms, maybe like with no loss of consciousness, no vomiting, earaches, urinary tract infections, pinworms, ringworms, and pulled muscles.
That's something I don't hear a lot about. Pinworms, ringworms.
It's very common. It is very
really?
common. Yep, yes.
Okay. Now, ER turnaround. I've heard that term before, but what does that mean?
Turnaround time refers to the time the patient, from the time the patient enters the emergency room until the time that they are discharged.
Okay. So the whole revolving.
Exactly. They check in at the hostess desk, and that's when their time starts, and it ends when they are discharged. Decreasing turnaround time is important because there's a relationship between the patient's outcome and decreasing their time. There are situations where they could be loss of deprivation of oxygen, loss of blood, loss of a limb, and those are very time sensitive. You want to get the patient back and seen in a very timely manner. And
do y'all have a set number like at Terrebonne General that you try to get them in and out?
Yeah, well, there's a national average of 180 minutes. In May of this year, our turnaround time was 151 minutes.
Ah, so y'all beating the curve.
Oh yes.
All right. You always want to beat the curve. You make an A when you do that. Let's talk about a parent or a guardian. What's information they should know before going to the emergency room, Kim?
Some information that they should bring with them is the patient's past medical history. They should know that. Their immunization status. They should know their medications and the dosages that they're taking. I tell adult patients it's a good idea for them, for the adults, to bring something maybe on a card or on a piece of paper that has everything about them that we need to know. Their past medical history, their medications, why they're on those medications, the dosages, their family doctor's name. So we could just take their information and record it into our data.
Okay, what we're going to do, we're going to take a short break here from Terrible in General, and we're going to come back and recap some more, okay? We'll be right back. Don't go away.